front desk training. I want you all to kind of take a look and see how I handle the phone call. And you guys decide, is it important to train a reception person and be great? And would you hire me? Yes or no? Good. So Dr. Williams, you're a patient calling around to find out how much crown costs. You're shopping. You got some diagnosis from some other practice and it scared you or whatever. You got the scenario?
Yes.
Good. Let it rip. Bring, ABC Dental. This is Dan. How can I help you?
Hi. I wanted to know how much do you guys charge for crowns?
Sure. Love to help you with that. Can I get your name?
Hi, my name is Gabrielle.
Gabrielle. Fantastic. Gabrielle, hey, just in case this call drops, what's the best number to call you right back?
704-596-8949.
Fantastic. And before we get to your question, which I'm about to answer, can I just ask how you found out about our practice? It just helps us.
Oh, I just Googled dental practices 28213, and yours was the second on the list. The first one on the list they didn't even pick up.
Oh, wow. Well, thank you for calling. Good. So, Gabrielle, tell me a little bit about, I'm going to tell you, there's lots of different answers to that question. What tooth are we talking about? Is it multiple teeth? Can you tell me why you feel you need a crown?
I have a tooth with a really, really big hole in it, and I know that the hole is probably too big for a filling, and so I know that it's probably very likely that I'm going to need a crown.
Sure, could be. All right, and Gabrielle, tell me where are we talking about? Is it the left side or the right side of your mouth?
It's on the right side, the very last tooth, all the way in the back.
Gotcha. Okay, good. And how long has it been like that?
Well, I don't know. I was biting some food one day, and a little piece of tooth came out. And then once that piece came out, then I noticed that there's a hole there.
Gotcha. Okay, can you tell me when that happened?
That happened about 2 weeks ago, and I'm just now getting around to giving you a call.
Well, great. Well, I'm glad you're calling. It's good that you're moving on this. Is there any sensitivity to hot or cold or pressure? Anything that's like it's uncomfortable or painful?
No, it's not uncomfortable or painful. I just know that there's a hole there, and there shouldn't be.
Totally. Great. Okay, good. Well, listen, here's what I can tell you on crowns. The cheapest crown there is a crown you don't need. Okay. And I'm not saying you don't need one. I'm not a doctor, so I'm not going to diagnose. I haven't seen it, right? But I just want you to be aware of the fact that, it'd be best to have it looked at by the doctor. And you might not end up needing a crown, but let's leave that for the doctor. The good news is that you're calling and you're on top of this. Now, there's two things I want to warn you about. And see if you're interested in this. First thing, between now and the time that you come in, I do want you to chew on the other side of your mouth. We don't know how compromised that tooth is, and say it is quite compromised. Say you bit down on something that was really, it could be a breadstick or something like that. We could break that tooth, and now we're not talking about a crown or some other treatment, and we have to be doing something more invasive and more expensive, which we could do here at ABC Family Dentistry. But if you're calling to find out how much crown costs, I'm sure price is a concern. So we don't want to play with fate. So can I get your agreement to chew on the other side of your mouth until you get that addressed?
I'll try my best.
I know it's a bit annoying, but just do your best. The second thing is let's get you, seen and address this, because it's kind of a hard thing to remember. So I can get you in quick here, and we actually can do a free scan on that for you. We just do a free consultation where we look at it and we'll tell you what we would suggest doing to handle it, or different options, and what it would cost. Now, there's no obligation and there's no cost for that. So I can squeeze you in. I've got time this afternoon, and I could squeeze you in tomorrow morning. I think the sooner the better. What do you say?
Tomorrow works a little bit better for me because I can talk to my boss,
Sure.
but right now I don't think I'll be able to get off on such short notice today.
Gotcha. Okay. And so I think you should do that, obviously get his approval or her approval. But let me ask you this. What time do you think it'd be, say your boss was okay with it?
Around first thing in the morning before I go in. So how early are you open?
We start seeing patients at 8 a.m.
Okay, I can be there at 8 when you open.
Okay, good. Well, here's what I'm going to do. I'm going to put you down for 8. Obviously, you talk to your boss and you call me back if there's an issue. And let's get you in between now and then. However, I really do want you to just kind of play it safe. I know we've been lucky these last 2 weeks, and maybe there's nothing to be concerned about, but we've had it happen here where somebody was all set and ready to come in, and then something happened, and now the procedure got more complex or more expensive. Again, we can handle anything here at ABC Family Dentistry. I just don't want you to have to experience that if you don't want to. Do you know what I mean?
Okay.
Good.
I just won't eat.
So let's do this. Yeah. Let's do this. I'm going to get some information from you, and then if you wouldn't mind, I'll call you. You want to go over it with your boss, and I'll call you in about a half an hour.
Sure, that sounds good.
Beautiful. We'll do that. Any other questions for me right now?
Nothing I can think of.
Okay, good. All right. I'll be talking to you in about 30 minutes. Okay.
Okay. Thanks.
Okay, great. Good. How many of you would hire me as your receptionist? Some of you are like, no. Yeah, I didn't do you don't do an estimate over the phone is a question. I don't give an estimate over the phone. Giving an estimate over the phone, listen, if she would have said, Dan, I just need to know what it could cost if I need a crown. Please just answer the question. I might give a range, but I can't give an estimate, but I do want to, I'm not a doctor. I can't do that. But I never answered her question. It's not because I didn't want to. It's because I really shouldn't be answering her question. I don't know that she needs a crown. It might be an onlay. It might be something completely different. And here's what I want you to think with right now. Think with how long that scenario was. I think it was about 5-6 minutes, and we were moving along just nicely. I need to have the bandwidth. I need to have the capability. I need to have the skill to do that. And there's a good chance that the phone was ringing, while I was on the phone. So I just want you to think. You got to have somebody not only trained on that, but you have to have the rest of the team clearing the road so this person can do that job right there. Last point I want to talk to you. I know some of you are going to go like, why are you asking what tooth it was? And what side is top or the bottom or the back or the front? Okay, the reason I asked that, well, you tell me, you put it in the chat. Why do I ask that question? Yeah, of course you could do it, whether it's to the front, the back, the side, the top, the bottom. Of course you could do it. Why did I ask those questions? To show that I care and are interested, have the patient talk about themselves. Spot on right there, Dr. Sorrell. Good to see you, by the way. Yeah. There's one thing people will talk to you all day long about. One thing, themselves and their problems. So you get that person talking. And it's very important to generate that interest and be interested. Now I have a better understanding of why, if I just answer the question, well, our crowns range from blah to blah, and it's just very important that I know more about that person. I've got a connection with, in this case, Dr. Williams. We connected. Now, did we connect amazingly? I don't know. I think we connected enough to where she's probably going to call her boss and see if we get the time. If she can't get the time, we'll work out something else. But I've got somebody retained. And if I never got that person scheduled, I know what made the phone ring. And if something did happen, I didn't hear from her, I've got a phone number. So thumbs up if you follow everything about that. I just want everybody to think with the value of having your team trained on this and going through the training on DDS success and what we cover in the marketing course there and handling phones there and such. And with that, that wraps up this webinar.